I'm Dr. Phillip Williams from Dallas, Texas, and I'm chairman of the Archives Committee for the American Association of Neurological Surgeons. We're here in Toronto, Canada today, and I have the opportunity to visit with the honored guest of the Congress of Neurological Surgeons. In October 1982, we're visiting with Dr. Keiji Sano, who's professor of neurosurgery at Tokyo University. Dr. Sano is the honored guest of the Congress of Neurological Surgeons, and he's been very kind to sit down with us today and talk a little bit about neurosurgery as he has seen it evolve over the last number of years since he's been a neurosurgeon. Dr. Sano, appreciate your being with us today. Tell us a little bit about your background, where you're from, where you grew up, your family background, whether there were physicians in the family.
Well, I was born in 1920 at the foot of Mount Fuji as a son of a surgeon practicing there, and educated at the University of Tokyo, at that time called Tokyo Imperial University, and graduated in 1945 in the last year of the World War II. And the last 4 months after graduation, I served as a naval surgeon in the inner naval hospital, because at that time all Japanese ships are sunken, so I had to remain on the land.
I see. And then after your completion of
Yes.
World War II, and your
Yes,
in the Navy,
I went back to the university, and then I was appointed assistant, then lecturer, then associate professor. Then 1962 I was appointed. As a matter of fact, I got the first chair of independent neurosurgery department of Japan.
I see. Now, where did you do your neurosurgical training? Did you do all your training in Japan, or did you go outside of the empire when you?
Well, I received training mostly in Japan, in Tokyo, but about 1.5 years spent in the United States, in San Francisco with Dr. Naffziger, Dr. Boldrey, and then I did a trip around in North America, including Dr. Bailey, Dr. Penfield, as a distinguished.
So these are some of the great neurosurgeons who've meant a lot to you, Dr. Penfield and Dr. Boldrey and Dr. Naffziger, and Dr. Bailey. Now, your entire practice has been devoted to academics, is that correct?
Yes.
And is there private practice in Japan, as we know private practice in the United States?
Well, we have several private practicing neurosurgeons in Japan, but most of neurosurgeons in Japan are working as, in some big hospitals, including universities.
How many neurosurgeons are in Japan?
Now, a little more than 1,400 this year, yes.
It's pretty impressive. What would you say in the last 20 years has impressed you the most in neurosurgery? The thing that you think really holds the future to neurosurgery?
Well, in the field of neurosurgical techniques, probably introduction of microsurgery is most important event, and also in the field of diagnostics, CT, computed tomography, is the most remarkable event, I think.
Okay. What would you say is your most favorite operation? What do you enjoy doing?
I like most of neurosurgical operations, but probably I like operate on aneurysms.
Aneurysms? That's more your specialty.
Yes.
What's your least favorite operation?
Well,
is there one that you'd rather have the junior man do?
No, probably I like most of neurosurgical procedures. So.
I see. Now it's 1982. What do you expect to be going on in neurosurgery the year 2000?
You mean number of neurosurgeons? No.
No, the
I see.
type of work.
Okay, in the future, yes.
Yes, the future of neurosurgery, the type
Yes.
of work neurosurgeons will be doing, say, year 2000,
Yes.
18 years
Yes.
from now.
I think, so far, neurosurgery is the surgery of reducing something, removing something. Only exception is probably bypass, because adding circulation to the brain. And so in the future, probably we must devise surgery of adding, that is plus surgery, not minus surgery.
I see. What contributions do you anticipate the Japanese to be making towards neurosurgery in the next 5, 10 years? Is there any particular thing you think will come out of Japan that's not being done anywhere else?
Well, but probably, as you know, we have so many cases of cerebrovascular lesions, so maybe Japanese will contribute much to development of cerebrovascular surgery. And also, many neurosurgeons in Japan are interested in treating malignant tumors of the brain on spinal cord. So in that field, probably, we may contribute.
I had the privilege of living in your wonderful country for 2 years during the Vietnam War, and have great fondness for Japan and the Japanese people. A story I like to reflect is that one time I was operating, doing a disc operation, as I recall, and we had an earthquake, and I didn't realize it and thought that the anesthesiologist had let the patient wake up, but he assured me the patient was asleep, the room was just shaking because of the earthquake. You see many earthquakes in the operating room?
Oh, yeah. Yes, we have.
It's pretty unnerving. Well, I appreciate, and I know the neurosurgeons who will have an opportunity to view this tape appreciate the opportunity of sitting down with you, and the few Japanese phrases that I learned while I lived in Japan. I would say, "Domo arigato gozaimasu."
どうもありがとうございました。